Hello friends, I am Dr. Professor Rakesh Chopra. I have the honor and privilege to have started medical oncology, that's medical treatment of cancer, and hematology, medical treatment of blood diseases, blood cancers in North India. I'm also a professor with the University of Nebraska, where I do my teaching also. I'm an adjunct professor there. I have been asked to talk a little bit about cancer and why its prevalence is increasing in India and in the rest of the world. Earlier, cancer was mostly in Western countries and was less in developing countries or low middle income countries. But now the incidence is increasing at a very rapid rate in countries like ours or in countries with low and middle income countries and those which are less affluent as compared to the West. One of the reasons for this is the rapid use of tobacco. Tobacco is the relationship between tobacco and cancer is established. Some people would say that my grandfather smoked all his life till he died at the age of 90, but he didn't get cancer. Well, yes, he is fortunate that he didn't get cancer, but the relationship between tobacco and cancer is well established. Tobacco can come in various forms. You can have smoke cancers, that is smoking of bidis, of cigarettes, of hookah, or any other forms of cancer, which is due to smoking. Also, there is the smokeless cancers. That means the smokeless tobacco, that means pouches of hookah, etc., which contains tobacco, and that can be a cause for especially head and neck or oral cancers. In addition, even though you may take smokeless tobacco, you can get lung cancer also because of that. In addition to that, alcohol is another factor which can lead to cancers. Now, if you have tobacco and alcohol, you have 40 times higher chances of getting cancer as compared to a normal person. And if you take only tobacco and no alcohol, it's 20 times. And if it is only alcohol and no tobacco, it is 20 times. More higher incidence of cancer can occur if you take these two. The other thing is that obesity. Obesity is another factor which can lead to cancers, colon cancer, bladder cancer, and many other cancers. Also, this pollution is another major factor in which can cause cancer. And as they keep saying that if you are exposed to pollution, you can be exposed to so many cigarettes. If you are not a smoker, but you can still be exposed to that. So all these factors combined can lead to cancers of different areas. Excess fatty foods are also associated with breast cancer, uterine cancer, and so on and so forth. And colon cancer, the colon cancer of the intestines, the large intestines, that can produce cancer. Also, there are certain cancers which can be due to infections. For example, hepatitis B, hepatitis C can lead to hepatocellular carcinoma or primary cancer of the liver. Also, there are other cancers which can be produced because of, let's say, H. pylori. H. pylori is a bacteria which can occur in stomach and can lead to gastric cancer or stomach cancer. So one has to be cautious as far as these things are concerned. Chemical dyes, people who color their hair, people who use various chemicals, either in the skin or in the form of oral intake of chemicals, can produce. Fertilizers is another thing which can produce or lead to cancer. So that's why you have to wash your vegetables and fruits many times, and maybe even use potassium permanganate or soda bicarb to wash these vegetables so that you don't eat raw vegetables and it can produce. So these are the very, very major factors. Now also what happens is that the food handlers, now if they are not careful, that means that they don't see what food is being served to people and it's unhygienic food, that can lead to cancers. So one has to be careful. Also, the food that is being served in restaurants, in hotels, in dhabas, all over, plus the food that is being given to us, the wheat, the lentils, so on and so forth, that has to be clean and has to be hygienic so that it doesn't lead to cancers. So this is one of the main reasons. There are also other infections besides hepatitis B and C. There are several viral infections which can make you prone to cancers. Also, there are medications which can lead to cancers. So one has to be very careful in his day-to-day life and get oneself checked out regularly.